November serves as the month to raise awareness about men's health issues. One of those is prostate cancer. My dad, who's probably watching this morning, is a prostate cancer survivor. But the disease isn't something a lot of men, they don't want to talk about it. Believe me, my dad was one of them. Joining me live from downtown is Dr. Clint Baylor, a urologist at IU Health. Doctor, so good to see you. Thanks for joining us.
Great to be here with you.
I know my father is one of those, he's in his 70s and you don't talk about this kind of thing. Prostate cancer is the second most common cancer, though. And I'm glad that more men are finding, like you're smiling. I mean, it's something that we are getting more comfortable with talking about.
Yeah, and there's good news to talk about it. Most cases that are diagnosed in time for a cure. So there's good news.
What do you want to tell people as far as, it's pretty rare for somebody under 40 to get prostate cancer, but how often and when should they be doing this early testing to make sure that their cancer doesn't turn out to be more serious, not just in terms of death, but in terms of quality of life, if we'll call it that?
Yeah, so prostate cancer is interesting in that there's really no symptoms. The urinary symptoms, difficulty urinating or weak stream, are related more to benign BPH. But prostate cancer really doesn't have any symptoms until late in the disease. So it's really important to get PSA screening, and that's just the blood test that's done annually. But with PSA screening, most cases are diagnosed early enough in time for a cure. And it's also important to note that not all cases of prostate cancer are aggressive. So there is a type of prostate cancer that we call low risk that doesn't need any treatment. But the important thing is to get the PSA screenings so that we can know if you have a more aggressive type that needs to be treated in time for a cure.
I know that's one of the important things you wanted to get across today, really, is that men need to make that a priority to get the screening, because like you said, it's so easy to have your blood looked at as opposed to waiting for maybe a decade. My father, he didn't go to the doctor for decades. He didn't want to go. He was like, I'm fine, I'm healthy, I don't need to go. And that's not always a good thing.
Yeah, and it's so hard to think of, you want to catch a cancer before there's any symptoms. And so fortunately we have the PSA, we have the digital rectal exam, and we would recommend, by the time you hit 50 to do that annually, once a year, at least through 70, and in some cases 75. But there are some higher risk groups that you might consider doing that starting earlier.
We have 10 seconds left. I want you to have the final word on what you want patients or people to know this morning.
Yeah, that PSA screening or cancer screening is investing in your future. And you want to take a very personalized approach so that you don't, the cure should never be worse than the disease. Mm-hmm. Not all cancers need treated, but if you have an aggressive cancer, you want to treat it in time for a cure.
Dr. Baylor, we appreciate you. Thank you for helping save lives like my father. So good to see you. If you'd like to learn more about prostate cancer, fox59.com/links. And Jim, we can joke all the time about, I know guys don't like to get the prostate test, but at least get the screening, okay?
Yeah, and you have to do that.